All right, today we're diving into a medical condition that affects millions of men all over the world. And on the surface, it seems pretty straightforward. But if you dig just a little bit deeper, you find this fascinating global disagreement among experts on how to even handle it.
So first things first, what exactly is a varicocele? Well, to put it simply, it's when the veins inside the scrotum get enlarged. The easiest way to picture it is to think about varicose veins you might see on someone's leg, but just in a different location.
And this isn't some super rare thing we're talking about. Not at all. It's estimated that varicoceles affect about 15% of all men. That's more than 1 out of every 7 guys walking around.
Now here's why it gets so much attention from doctors. A varicocele is the single most common cause of male infertility that can actually be fixed. And that word correctable is really the key to this whole conversation. Which leads you to a pretty logical question, right? If it's this common and we know it's a problem we can correct, then the treatment should be a standard by-the-book procedure. But is it really that simple?
The answer, it turns out, is a huge no. A massive global survey, we're talking over 570 clinicians from 59 different countries, found that when it comes to managing a varicocele, doctors are deeply, and I mean fundamentally, divided on pretty much every single step.
So how does this disagreement actually play out in the real world? Well, it starts right at the very beginning with the first hurdle, just figuring out a diagnosis.
Okay, so right away we see this huge gap between the official rulebook and what's actually happening in clinics. The major guidelines from urology associations say, look, a simple physical exam is all you need. But in practice, the vast majority of doctors just aren't stopping there.
And the survey numbers really paint a clear picture here. You can see that over 70% of clinicians are using a physical exam plus an ultrasound. That means only about 19% are actually following the official guidelines to the letter. It's a massive split between the recommendation and reality.
And believe it or not, it gets even more complicated. You'd think, okay, let's just use the ultrasound. The machine will give us a clear answer. But nope. Even among the doctors who use an ultrasound, there's no agreement on how big a vein needs to be to officially be called a varicocele. Some say 2.5 millimeters, others say 3 millimeters. The standard is all over the place.
So if doctors can't even agree on a single standard for diagnosis, you can imagine what happens when it's time to decide on treatment. This brings us to the next big chapter, the great debate over whether to operate.
Let's put this in a real-world scenario that a lot of couples face. Let's say a man has a varicocele, and the couple is having trouble conceiving. They're thinking about IVF. So the question is, should he have surgery to repair the varicocele before they try IVF?
Well, the answers are, you guessed it, completely fragmented. While almost 63% say yeah, they'd recommend surgery before IVF, their reasoning is all over the map. 40% say it depends on the woman's age. Others would only operate after IVF fails, and some would just skip the surgery altogether. I mean, you could ask 4 different specialists and get 4 totally different plans.
But here's what might be the most shocking finding in the whole survey. Get this. More than half of the doctors said they'd consider operating on something called a subclinical varicocele. What that means is the varicocele is so small you can only find it with an ultrasound. You can't even feel it in a physical exam. And operating on those goes directly against all the major medical guidelines. So let's say the decision is made and it's time for surgery. You might think the disagreements would stop there, but they don't. They follow the patient right into the operating room.
It turns out there are a bunch of different ways to do the repair. While this one approach, the microsurgical subinguinal technique, is the most popular, and a lot of people consider it the gold standard, it's still only used by about half of surgeons. A pretty big chunk still prefer other more conventional methods. The tools and techniques really vary from one doctor to the next.
And this is a big one. After the surgery is over, how do you even know if it worked? How do you define success? For almost 60% of doctors, a win is just seeing better lab results, an improvement in semen parameters. Only 16% say success means an actual pregnancy, and just 10% are focused on the ultimate goal for most couples, a live birth. The very definition of success is up for debate.
So where does all this leave us? We've got disagreement on how to diagnose, when to treat, what surgery to do, and even what a good outcome looks like. So let's pull back for a second and talk about how to navigate all this uncertainty.
It's just crucial to remember the scale here. This isn't one hospital doing things differently or a debate between 2 cities. The survey covered doctors from 59 countries across 6 continents. This is a truly global phenomenon, a worldwide lack of consensus.
Honestly, the study's own conclusion just says it perfectly. It says, and I'm quoting here, this study demonstrates a wide disagreement in the approach to varicocele management and large gaps in the clinical practice guidelines. I mean, the experts themselves are pointing out the problem.
And this is a really important takeaway. This isn't a story about good doctors and bad doctors. It's a story about a really complex area of medicine where the science is still playing catch-up. And whenever the evidence isn't 100% clear, it leaves room for different, totally valid, expert interpretations.
So that leaves us with the biggest question of all, doesn't it? When the experts themselves don't have one clear answer, how do we, as patients, navigate all this? How do we work with our doctors to make the best possible decision for our own health?